Hi everyone, welcome to the CME on pharmacotherapy of polycystic ovary syndrome. I am Dr. Sumita, pharmacologist from Chennai. So World PCOS Day is celebrated on 1st September 2023. The objective of this day is to support the people who has been impacted by PCOS and also to create awareness among people. So this polycystic ovary syndrome is the commonest cause of anovulatory infertility, and about 18 to 30% is very common among women of reproductive age group. 50 to 70% of the women are insulin resistant cases. So coming to the diagnostic criteria, according to the modified Rotterdam criteria, at least two of the following should be present. There should be clinical or biochemical evidence of hyperandrogenism, and there is evidence of oligoanovulation, and on ultrasonogram there is polycystic ovaries present. So pharmacotherapy of PCOS, it have its aim on insulin resistance, on treating the hyperandrogenism, and also to treat oligoanovulation. So coming to the important drugs, which is myoinositol. This myoinositol, it also acts as second messengers. It regulates various metabolic and regulatory processes. So when there is a deficiency of inositol, there will be decreased level of PI3 kinase. So there will be decreased glucose uptake, which results in ultimately hyperinsulinemia and insulin resistance, which in turn will increase the testosterone levels. So when we give this myoinositol, it increases the insulin sensitivity, it decreases the androgen levels, and it also improves the oocyte quality in PCOS. It also has a free radical scavenging property. So D-chiro-ionositol, it also increases the FSH signaling. It also increases the insulin signaling, thereby it increases the glucose uptake. So it has been used in PCOS patients. When myoinositol and D-chiro-ionositol in a ratio of 40:1 is given, it can improve or restore the ovary function in PCOS patients. Vitamin D supplementation in PCOS, it can suppress the pro-inflammatory cytokines which mediate the insulin resistance. It also can enhance the insulin action. L-methylfolate, it also increases the peripheral sensitivity of insulin. It also improves the oocyte quality. It can also restore the normal homocysteine levels, which is very useful in PCOS patients. So coming to the clinical trials of all these drugs which we have discussed now, when a clinical trial was done with metformin plus myoinositol compared with metformin alone in PCOS patients of 52 patients of age 18 to 40 years, when the treatment was given for 12 weeks. After 12 weeks of therapy, letrozole was given, which is a ovulation inducing drug, 5 mg was given starting from second day of menstrual cycle. It was given for 5 days. So on the 12th day of therapy, the outcome of the study was to see the pregnancy rate and ovulation rate. So in this table, we could see that in group A, there is an increase of mature follicles which is present more than 18 mm, and mid-luteal phase progesterone which is more than 3 nanogram, which is an evidence of ovulation rate is more in group A, which has metformin and myoinositol. Similarly, the pregnancy rate when we see in group A, it is more when compared to group B, which the patients have taken only metformin. So in the second clinical trial where myoinositol and D-chiro-ionositol was seen for the improvement in therapy of PCOS patients. So this group A, they have taken myoinositol plus D-chiro-ionositol for 6 months, and group B, they have taken placebo for 6 months. So when pre-treatment and post-treatment value was assessed in clinical variables of obesity, menstrual irregularity, hirsutism and acne, we could see in group A, where the patients have taken both myoinositol and D-chiro-ionositol, there is a improvement when compared to the baseline, blue color baseline and red color which shows the post-therapy outcome. So it is more in group A patients. Next clinical trial where myoinositol and methyl tetrahydrofolate was assessed, where the pre-treatment effect of these drugs of ovulation induction was assessed in 25 patients in group A and group B. Group B, they have taken placebo. Group A patients, they have taken myoinositol and methylfolate. So the treatment was taken for 3 months. After 3 months, the ovulation induction was done with clomiphene citrate. So the outcome of the study was to see the pregnancy as well as ovulation rate outcome. We could see in group A, where the patients has taken myo-inositol and methylfolate, when compared to placebo, they have an increased ovulation rate and they have an increased pregnancy rate in this study. So when vitamin D deficiency was assessed in polycystic ovary syndrome patients, 267 patients were enrolled in the study. Group 1, they had vitamin D deficiency. Group 2, they have normal vitamin D deficiency. So in this study, they compared the serum testosterone levels, DHEA levels, FSH and LH levels among the two groups. When it was compared in group A, where the patients of PCOS have vitamin D deficiency, we could see an increased androgen level when they have the vitamin D deficiency. So vitamin D supplementation might be helpful in PCOD patients, which could be seen from this study. So our product, the Cystop M, which has myo-inositol metformin, and Cystop obis, where myo-inositol D-chiro-inositol is present, and Cystop OD, where melatonin, myo-inositol, D-chiro-inositol, methylfolate, vitamin D3, Cystop MET, where myo-inositol, metformin, methylcobalamin, methylfolate and D-chiro-inositol. All these products have a very efficient role in PCOD treatment.